on WKBN-27 First News Sunday morning.
February is all about hearts. There's Valentine's Day, but most importantly, it's also American Heart Month. And because heart disease and stroke is the leading cause of death for Americans, it's important that we know how to stay heart healthy. And joining us again this morning to talk about our hearts is Dr. Mike Sevilla from Family Practice Center of Salem. So good morning.
Good morning.
Always good to have you here. So we were talking last hour about heart disease and how it's, that silent killer that a lot of people just aren't aware about.
Yeah, I mean, American Heart Month had started in 1964, first proclaimed by President Lyndon Johnson, has been every year since then. And we talked last hour about risk factors, but I think, I get a lot of questions about, what are some symptoms of even having a heart attack. And, some people say, they have this piercing kind of chest pain that radiates to their arm and to their back. Some people have sweating and also some nausea symptoms. If people have those symptoms, definitely either call 911 or go to the emergency room immediately.
And if you're not necessarily having those symptoms, of a heart attack, are there still other things that you may be experiencing on a day-to-day basis that could be related to heart disease? That's
a challenge because sometimes people can have symptoms like that could kind of come and go. Some people can feel like it's kind of heartburn type of symptoms. Some people can get dizziness. It doesn't happen every day, but those could be the early signs to visit your doctor and get checked out right away.
And we had said that, like you mentioned, talk with your doctor, find out your numbers, your cholesterol, BMI, things like that. So what are some of the steps that you can take to improve your heart?
Well, as far as prevention goes, the first thing is to visit your doctor. And if you are smoking, definitely stop smoking. That's probably the best thing that you can do. You can exercise, 30 days, most days of the week, get enough sleep, and eat that healthy diet. Probably more vegetables, more fruits, less salt, less sugar, probably not your typical big game diet.
Sure, because we were talking about that food all morning, so maybe take it a little easy today.
That's right.
All right, thank you so much, Dr. Sevilla. We'll have all this information on our website as well, so people can find out what they need to do to stay heart healthy.
Thank you.
All right, thank you.
You're watching WKBN-27 First News.
February is all about hearts. There's Valentine's Day, but more importantly, February is also American Heart Month. And because heart disease and stroke is a leading cause of death for Americans, it's important that we know how to stay heart healthy. Joining us this morning to talk more about our hearts is Dr. Mike Sevilla from Family Practice Center of Salem. So always good to have you here. Good morning.
Good morning.
Yeah, so it's a busy month for getting awareness out about our hearts and how to stay healthy. So, why February?
Well, I think it just kind of makes sense with Valentine's Day, and we do know a lot of people, especially, are worried about cancer, which I think is very important. But the most leading cause of death is heart disease, and I think that's why they pick out February for that.
And oftentimes I hear that it's kind of referred to as the silent killer.
Exactly, because most people usually don't have symptoms at all, and that's why we really try to educate people, like knowing their numbers and kind of knowing what their risk factors are.
And so how do you go about knowing your numbers, knowing your risk factors? What do you need to do?
Well, the first thing is kind of to visit with your doctor, and the other thing too is, when you look at your risk factors, you look at things like, what is your blood pressure? Do you have high blood pressure? Do you have high cholesterol? Any history of diabetes? And I get a lot of questions about family history of heart disease, and that's something I talk a lot about with my patients.
And because there's some things that you can change and some that you can't, which is one of those things would be family history.
Exactly, exactly. So a lot of people kind of focus in on that, but a lot of people can look at their blood pressure, kind of see what their numbers are, and those are things that you can fix.
I think it's important too to note that heart disease, stroke, this doesn't discriminate, man or woman, and age too.
No, exactly, exactly. So one of the things there is to kind of look at what your numbers are. Some people have health screenings, especially going to your doctor, getting your regular checkups, seeing what your numbers are. Those are the most important things to kind of start out to educate yourself as far as what heart disease is.
And like you said, talk with your doctor, get things going now, because it's never too early to start taking care of your heart.
Yeah, especially sometimes unfortunately sometimes people have a bad event, whether it's a heart attack or a stroke, and that's when people start to pay attention to that. But it's important to kind of be preventative and look at your numbers, kind of see what your risk for heart disease is, visit your doctor and find out what those are.
And that's why having the awareness is so important. But there are also some steps that you can take to start getting on the right track now. So we'll have all that information coming up the next hour. You're going to stick around and talk to us a little bit more about that.
Sounds good.
All right, wonderful. Thank you so much, Dr. Sevilla.
Thank you.